All right, welcome back to the Pure Playbook. I'm Dr. Dustin Bosson with the Dr. Nate Merhaut. I'm going to be surprised on this one, I think. Dr. Nate's got us loaded over here, but let's get rolling with the podcast today. We've got some surprised information about to come our way, I'm sure, but hopefully everybody's having a great start to the school year. Most kids are starting at this point. We've got schedules changing, football starting. What are we at? Football, volleyball, softball. What else we got? Cross country. There's a lot of
swimming.
Yeah, swimming. Yep. So a lot of athletes that we've gotten here going on. But without further ado, let's see what Dr. Nate is going to come up with today off the top. Here we go.
All right. So this shouldn't be too bad. This will pertain and relate to all of our athletes because we're going to go through some of the top questions that our parents are asking us that we get related to sports injuries, related to their student athletes while they're performing, things that, they're not sure if they should continue to play, if they should pull them out, nutrition, recovery, all that kind of stuff that we talk about every day. But we just started another athlete last night, and there was a lot of great questions asked before they decided to start. They were pretty much in the whole time, even from the get-go. They came in more from the preventative standpoint. And the three ways that most of our student athletes will come in is either preventative, doing the pure athlete evaluation, acute injuries, where we have the athlete urgent care, or there's times where it's been a chronic nagging injury or something that's been on and off and they've gone everywhere and we're kind of like the last stop to go. And we oftentimes figure things out and give them answers. So,
and I might even throw in a fourth there and do like where some of the insurance leaves off after, even a big surgery. So there's even a fourth layer too. Now that you say that, of like, okay, well, we pick up where a lot of like, well, we're out of visits here. And it's like, well, we still have more to go. So we fill in on the back end too.
Yeah. Quite a few of our surgical athletes have been that way, where they've had surgeries and they just didn't get enough. They didn't get back to sports to 100% of what they should have gotten.
Right.
They got 80% of the good leg kind of a thing. And we've talked about that before, but let's get into a couple of these. I'll shoot some of them over. We'll see how many we get through. And there's probably going to be some questions maybe that Dr. Dustin thinks of along the way as well that are common questions. But
turn the tables on you here in a second.
Yeah. First question is, how do I know if my athlete is overtraining or just working hard?
Oh, for me, they'll tell you or they won't. And what I mean by that is they'll be so frustrated, their attitude will change, and they'll either tell you like, I'm smoked, or that attitude will tell you that they're smoked. Or if they just kind of shut down and recluse, that'll tell you too. I mean, those are probably my three top quick answers.
One of the things I noticed as an athlete, and I noticed this more so in track, is where numbers started going down, where you still felt like you were kind of putting the same effort out, but you just couldn't hit that number. You couldn't PR again, and where you were supposed to be peaking, but you really weren't peaking. And so, and everybody in training programs is going to peak a little differently. As a team, they try to get you to peak at the same time, but it can be very challenging. So you have to have a very good, science-minded strength and conditioning coach to be able to get the whole team to peak at the right times. But that was one thing that I would notice. So whether it's performance is going down, they're losing interest, they start complaining about more things, whether they actually are injuries or not, they're just complaining more. Those are some things that we noticed.
That was I was going to say too. I mean, as far as like, okay, a tangible, like from an athlete lens or a parent of a student athlete lens, only looking from the sporting perspective, is it's like, is their performance, endurance, stamina decreasing? How do they look when they're on the court, floor, field, pool, wherever you're at? And, is there recurring injuries? Is it ankle and now shin splints and now my hip hurts and now I'm getting headaches? Like, what's that look like? And if you're hearing that consistently every day, every other day, every week, could be overtraining too. Does your student athlete play multiple sports in the same season? I mean, my 8-year-old right now is going from soccer to hockey, and then he wants to play baseball outside in the backyard. And so you're going from some kids right now, if they're dual sporting, maybe they have morning practice and then they've got a different practice in the afternoon, or they go from their 3 to 5 practice to then their 6:30 to 8 practice.
Yep.
So just what's their schedule look like?
Yeah, well, you already pulled another question off, but I'll rephrase it. But should my athlete play multiple sports or focus on just one? I think another caveat in addition to that question would be if they are going to focus on just one, at what age or what time frame should they start to specialize in that one sport?
I would say yes to multiple sports.
Mm-hmm.
100% yes. There is a time to start dialing in and honing in on a focus. Again, 8 years old is not that time,
right.
But you're starting to hear a lot of things too. There was a retired, very great athlete who actually has a different perspective on this too, where it's like you're starting to come into a time where it gets very scary to multi-sport.
Mm-hmm.
If your kid shows a lot of promise, a lot of desire, a lot of love for a sport, and maybe they do want to take it next level, it's almost like it seems like you're running into a time where it's like you can't afford to play another sport and you need to focus on your craft.
Mm-hmm.
That's a different conversation. But growing up, junior high, even pre-junior high through most of high school, multi-sport, soccer and hockey go well together. Hockey and golf go well together. They all go well together. The hand-eye coordination and the cortical centers and how you map brain, synapses in the brain and create a lot of that coordination and reproducibility. Muscles don't have memories. Okay. So it's not muscle memory. Let's all just lose that term. Muscles don't have brains, so they don't have memories. It's literally a learned response. Yeah. But having, a lower half dominant sport, having an upper half dominant sport, having a whole body sport, and at the end of the day, just having different sports that require a different vision. Mm-hmm. Hockey and soccer are similar, even basketball similar to those three sports, but the vision can change and how the game moves can change. Then you go into football where it's not so back and forth. There's breaks, there's stoppages, there's a reset every play, and you've got this vision of 100 yards and 52-yard wide field, and that vision looks different. So absolutely, from cognitive, from communication, from culture, from technical skill, 100% double sport.
Yeah, I think where this conversation sometimes gets a little tricky is we recommend multi-sports at a younger age. And the main reason for that is exactly what you said. We're trying to hit different body parts and not just keep training the same body part over and over. So we want to do what we call cross-training. Mm-hmm. And so if you are specializing and individualizing in one sport, that's fine. But you need to cross-train at the same time. Yeah. And what that looks like is if you're training for baseball, maybe a day or two out of the week, your workouts are more in the swimming pool, or you're doing other lower body exercises because baseball's very upper heavy. So you're working in other things. You're doing pushes and pulls that are unrelated to sport-specific movements too. Even though sport-specific movements are important, you have to combat that so that you're not overtraining those muscles over and over and over again, leading to these overuse injuries. And that's what we see with these athletes that are doing single sport all year round. The other issue I also see with that is nowadays, totally different when we were playing sports. If you're specializing in one sport, you are playing all year round, and there are no breaks. You're going from one to the next. Oftentimes there's overlap with, club versus, high school sports, and you have that, and you never really get that break that your body needs. So understanding, why it's important to cross train, and if you are going to specialize in one sport, that's fine, but do it the right way and do it smart.
Yeah, absolutely. Absolutely.
All right. So this next one, leading into kind of overtraining and overuse injuries, is it safe for my child to play through pain?
That depends.
Yeah, that's a pretty loaded question.
Yeah, that depends. Here's what I think we're seeing more of, and really what we're learning more of, and it's okay. And this is why we do what we do, and why we come at this a whole lot differently, even from the relational standpoint of who we take care of. Is it okay for them to play through pain? In some scenarios, yes. But also, if they've previously been injured, you're probably pretty immediately for a period of time, and I'm still watching this. There's a couple athletes that I can think of right off the top of my head, but there's going to be an area of time where you're going to hear more from them about that they are in pain. Because if they've had any sort of injury, big or small, or maybe they've had to sit some games, in the front back of their head, they're thinking like, ooh, am I really going to be okay? In most scenarios, I pride ourselves on doing a very good job of encouraging them and qualifying them and letting them know, like, you're not going to hurt it.
Yeah.
But a lot of don't get that. So I think that's a time where it's like, if we're working with them, we're cognitive of bigger injury. They're probably going to feel sore, feel hurt, not in jeopardy, continue on.
Yeah.
And I think depending on what age you're talking about too, are we talking about an 8-year-old? Like my son last night said, Dad, my heel hurts. I think I need soft wave on my heel. Like literally, he's like, I think I need soft wave on my heel. I'm like, oh, he's got plantar fasciitis at 8 years old. Probably not the case. So they could be feeling new things that they haven't felt.
Yeah.
Again, he's had tryouts from Saturday, Sunday, Monday, off Tuesday, tryouts Wednesday, soccer practice Wednesday, Monday and Wednesday. And it's like, and he still runs like very heavy footed. And I'm like, dude, you're just bruising your heel. I didn't tell him that, but it's like, it depends on where they're at too. And then I'll let you kind of take on the other side. As they get older, there's things to watch for, but there's also things to watch for saying that, let's push through a little bit.
If you're playing at a competitive level, if you're not sore after a game, if you're not experiencing some kind of discomfort, we'll say,
you're on the bench the next game.
Exactly. You're not doing it right. So that's where, even just if we relate it to general workouts, when you're working out, you're breaking your body down. When you're performing, when you're in a game, you're breaking your body down because those muscles and ligaments, joints are performing at a very high level. There's lots of stress getting put in them. So your body has to rebuild itself. And if it's not rebuilding itself with proper recovery, and we've talked about nutrition and hydration, electrolytes, all the above, rest, then that soreness is going to build and build and build. And then at some point, there's a threshold that your body, has within each tissue, where if it surpasses that threshold, then pain becomes a problem. And it starts to become more of if we call it an acute injury, but it's something that's been kind of working up over time, that could lead into something that's chronic. So we want to be able to draw back and let the athlete learn their body. I like to have athletes and kind of gauge on how well they are with learning their own body. Some of them are very good and know like what's going on inside and out. Others are like, they have no idea, and they rely on us to really tell them what's going on. So that's something that can be learned over time. And I think with more aches and pains and more injuries, you get better at that, on what feels like a soreness versus what feels like, okay, this is a little muscle tweak. I need to draw back a little bit, maybe sit out, do some recovery, do some rehab, whatever it may be. And learning your body can be an art in a sense with a lot of these athletes. So at a young age, it's kind of teaching them that, when is it okay? When is it not okay? And sometimes as a parent, you might not know. So having a professional in your corner that can help guide the athlete through that, and so that they can start to learn, what's okay with their body. What does normal soreness feel like? At what point does it feel like it's starting to turn into something that I need to ask for help? Yeah.
And that's why we have an injury evaluation. Like there's, like you said at the beginning, there's a few different ways that these athletes enter into the Pure Athlete practice itself. And so if you have any questions, I mean, if you're local to us, or, God willing, we put a couple of these locations around and they end up near you, or if you need somebody, or if there's, even if you don't reach out for a referral from us, if you're going somewhere, like wherever you're at, get an evaluation done. Like, don't take it, just push through, because then you run the risk of like, I wish I would have known. So right now, depending on where you're at in the development of your athlete, or, where they're at in communication, or, whatever the case might be, if you're hearing something and somebody's unsure, get it looked at. Like, so, and if you're local to us, schedule an injury evaluation. We'll take you through it, and we'll tell you what it is, what it isn't, and how to proceed going forward. But it's better to do that than wait,
So I didn't come up with this answer, but I think this answers for itself based on our podcast. But what can I do to help my athlete avoid these injuries?
The Pure Athlete evaluation.
Yeah. And a perfect example of this was last night when our athlete was starting care. we sat down with them, went through a lot of the data, and she had a couple previous injuries that she was dealing with. Not really something current right now, but she had an ankle sprain that was more chronic, and then some knee pain and some patellar femoral stuff that was going on. And so we were able to uncover some of why that was happening. And that's really what the evaluation is for, because, you can do everything and anything from PT to chiropractic, but if you don't specifically do an evaluation that can break that down, not to even mention what the structure looked like underneath, we got into that a little bit, and she has never received chiropractic care, so I was able to give her a first adjustment yesterday as well. But they find something that can uncover where your weaknesses are, and we always kind of talk to the athlete about, we're going to talk about a lot of things that are wrong with you per se, but there's also a lot of good that we don't talk about with these athletes. So most of these athletes that are coming in are very high level, are very competitive, and
high club,
move very well.
Yep.
It's just we're finding the little pieces that can make them even better, as well as give them answers as to why these injuries keep happening, and let's start to prevent them and bulletproof them from other injuries that are more catastrophic that could potentially be down the road. And let's get to it quick now before those things happen.
Yeah. And my whole thought process behind this, and us working as a team on this too, is it's like, the vision for this for me was a lot of what we went through. And we've talked about it a little bit on the podcast, but with exactly what you're talking about, the diagnosis tells you what it is. Oh, they have patellar tendonitis.
Yep.
Oh, they have tarsal tunnel syndrome.
At the site of pain.
And so it's like the diagnosis, like there's times I just wish the diagnosis would go away. Yeah. Like if there is pain and soreness, like then your foot is sore. Like, why do we need, it's tarsal tunnel? Like, let's just get rid of that. Now, if you have torn something and there is evidence, you have a torn ACL. Like, what's the cool name for a torn ACL? Why don't we have a cool, like tarsal tunnel syndrome?
Right.
Like, what's the cool name for it? So the big diagnoses that actually matter are just, here's what it is. What if we flip that?
Yeah.
And it's like, okay, let's not worry about the big cool name it's called, because the site of diagnosis and the site of pain isn't always the site of issue that created it. Now, you snap off an ankle, different story, but it's like, man, I'm starting to get like pain in my kneecap in the front. Okay, if it's patellar tendonitis, let's just not say that.
Right.
And what's going on? How did that happen? Who cares about the what? What is it?
Yeah.
What play are we running? It's like, you don't have to tell me it's, trips left, X right, hot, and it's just, no, just tell me, you go that way, you go that way, you go this way. Like, that's what we're going to do. And it's like, at the end of the day, the touchdown happens in the end zone, right? The points are scored in the end zone. What did it take to get there?
Yeah.
That's and that's where we're looking at this different. And that's why even when she comes in, those were some chronic things and previous injuries. They literally walked in the door for injury prevention. So, and we've gotten some good feedback, even on the website, with things like that you're talking about right now. It's like, she called me and she's like, well, I just wanted to call because we want to do the evaluation, but it looks like it's for injuries. And I'm like, well, that's good feedback for us. Like, great. No, this is the evaluation you want to do for injury prevention.
Yeah.
We use it for injuries, but they're looking for injury prevention. So what we can find, the susceptibilities that we can uncover, then a lot of parents, it's like, well, she did have an ankle sprain about 3 years ago. Okay.
Yeah.
Right. So there's so many different angles of that, but just know that the site of the diagnosis and the site of where the pain is, unless there's an active trauma to that area, might not be the primary site of what caused it.
Yeah. The cool thing about the evaluation is that, yes, it can uncover why things have been happening over and over, why you had an ankle sprain, why you tore your ACL, why you're not back to 100%, as well as, okay, you're loading the left leg a lot more than the right leg. This, if it keeps happening over time, you're going to start to develop an overuse injury, whether it's shin splints, a stress fracture, something like that. So there's predictability within the evaluation that can say you're more susceptible to these types of injuries, even though you've never had this injury, as well as uncovering, I've had this injury. Okay, why did it happen in the first place? Because it was non-contact.
Right.
And it'll uncover all those kinds of things. So we get quite a bit of data, and we can give quite a few answers, as well as project into the future, what could potentially happen if nothing's done.
And then what happens 3 months later?
Oh, and then we retest it.
And then we do it again.
Yeah,
we show you.
We have some awesome before and after results.
Man, Naomi's was
with
much.
Yeah, so
that's just one.
I mean, you go from So 40, let's just say 40 degrees of dorsiflexion is what our test says is standard and what you should, the target mark. She was about 10 degrees short, so around 30 degrees on both sides, really. And she went from 30 to 50. And we redid her test, and it was a 6-month time frame. But that amount of change.
You know what we need to do is we need to take that specifically. We need to get the okay from them. Can't say last name now because I said the first name. We need to get the okay from them and talk about why that is so important, especially when it comes to preventing knee injuries, let alone ankle injuries, but ACL injuries, hip labrum injuries. It's like, just imagine the range of motion, being able to go farther. The more dorsiflexion as your foot, am I going to go into it now? No, a little bit, but the more dorsiflexion you get, you pull your toes towards your nose. Like, try to do a squat without bending your ankles, first of all.
Right.
And now think of playing soccer and making a quick stop and turn, and your foot only goes so far. Your ankle only bends so far. If you have another 20 degrees as you're traveling, listen to me, this is like physics. This is great. I don't know where this is coming from. I don't know where this is coming from. But if you have another, she's at 30 degrees. Now she's like at 50. If you have another 20 degrees of movement forward, you're also absorbing and dissipating force to be able to make that turn and change in position. What if that sucker just slams stop at 30 degrees and then you rotate? It's like you're absorbing force the farther you go and weakening the chance of tearing that ACL. Like, holy cow, huge.
Yeah. And I'll give you a little insight. We did not just work on the ankle.
No. No.
There was some structural things in the hips that, a little bit of pelvic torsion and anteversion and, some flaring of the hip that we could get into detail and actually pull our x-rays up and show you guys. But there was structural change on the re-x-ray films as well. And so both functionally as well as structurally, we showed change within that time period. And
under a year.
Yeah. And the thing about our athletes too, I'll go into this little caveat, is student athletes are growing. Their growth plates are open. Their bodies are constantly changing. Yeah. And we have to try to keep up with that constant change. When we have someone that comes in and we find a scoliosis, there's a chance that it looks the same when we re-x-ray. There's a chance it looks worse. There's a chance it looks better. And the reason for that is because sometimes you're growing at a very rapid rate. And, if we say we need you in here twice a week, maybe it should have been 3 times because of how fast you grew. And we just didn't keep up with that. And then we kind of restructure the care plan to make sure that we stay on top of it. And that's why we also will retake them periodically to make sure that those changes, if they are happening, they're happening for the better. And if they're not, then we call an audible and change things up so that we can fix it.
Yeah.
All right, I'm going to go through one more.
Okay.
And this is something that we have gotten a little bit more into and have gotten more specific to our athletes. And the question is, do supplements, protein powder, or sports drinks really help my athlete?
Yes. Yes, they can. But remember, they're supplements. They're not replacements. So that's the meal replacement shake days of like the Atkins diet and your meal replacement, that gone. Like, it's never a replacement. It's a supplement. So if they're sucking down 6 of those a day, if like 50% or more of their nutrition is from that, kind of doing it wrong, it's a supplement.
Yeah.
But yes, they can.
Here's one of my pet peeves with this question is if you're asking this question and I'm giving you an answer and I'm recommending something, I'm saying, oh, you need to take, let's just say, we're going to take this probiotic and it needs to be this strain. Don't just go out and get it yourself. Go with the one that I'm recommending because I'm recommending it for a certain reason. And the supplement industry, unfortunately, is very poorly regulated.
Yes.
So we have vetted all these companies to be able to give the recommendations on the right ones for our athletes as well as our general clientele. But on Amazon, there are tons of studies that show if you're going and getting supplements on Amazon or going somewhere else, you can test those supplements and you're not getting what you think you're getting, even if it's a brand name.
Keep talking to yourself. I'll be right back.
So what we've done is Dr. Dustin and I have really taken, it's been months that we've worked on this. And he just came over and pulled out our Pure Athlete. This is the... Which pack? This is your pack that you're...
Yeah, that's the injury support.
So injury support pack. We got some vitamin D, K2, mineral complex, magnesium chelate, and attendance support. So we have a couple different packs out there for our athletes. Just a general one that majority of our athletes, even if we were to do blood testing, those recommendations and the things in this box would already be in there because we're all of our athletes are deficient or need some of this in order to recover properly, as well as just stay healthy in general.
Yeah.
So back to my pet peeve, when we are giving recommendations, and this happens all the time, they'll come to us and say, hey, what do you think about this one? Or, hey, what do you think about this one? And then they'll go by it. Hey, I've been using this one for a couple months, blah, blah, blah. It's like, let us save you some money. Full disclosure here, we do not make a lot of money off of supplements. We make very little. It is not a business that we want to be in. The reason we're in it is because we want to answer these questions and give quality products so that they're absorbable. So you're getting what you're paying for, and you're not getting anything extra that you don't need. And that's behind the whole mindset behind our program, and when we recommend supplementation and when we pair it with blood work so that we can be even more specific. We have a couple options right now where you don't have to do blood work, but if you want to and be more specific and just dial it in even more for those upper level athletes, we can go that route too.
Yeah, absolutely. So, I mean, to finish off that, and I guess again, shameless plug on these is it's like, yeah, this is not a necessarily a revenue stream. And some people are going to watch this as like, well, you're bad at business. Well, I'm in the business of taking care of people.
Right.
So it doesn't bother me. I'll figure out a different way. So but the unfortunate thing is kids are taking so many things and drinking the ghosts and all of the stuff with terrible stuff in it, or they're supplementing nonsensically. And it's like kidneys, appendix, liver, like there's so much you don't need to the excess. Oh, well, they're just vitamins. So they're just, it's like, well, until they cake the kidneys and you start throwing stones, or it alters the biochemistry of everything else. Not the body. There's so much there. Yeah. So what we do is, this is an injury support pack. Probably hold it for this. There's an injury support pack. Now, I literally, before we jumped on, I just ordered another athlete's supplements. So what we do is, say my son, we'll just use Kenton. Kenton's old enough now where if I wanted to start doing this with him, I could, but I would do it based on blood work. This, where it says injury support, would say Dustin Bosson, and everything in it would be what he would need. You flip this sucker over, and everything that would be his in his recommendation would be in this pack. He would then tear this sucker off, head to class, pop that in, drink his water, and he's out the door. If there's a PM pack, right behind it would be a PM pack. So what do you do with that? Brush your teeth, or put those in, swallow them down, brush your teeth, go to bed. Yep. It's that easy. So, but everything in here is designed for each athlete. We've got 5 or 6 of them. We just got all of this stuff cleared on our end. We know what's in it. We know what needs to be in it, and we order it specific to each athlete. Yeah. So it's sweet. But yes, if we're going to do that, do it this way. And if we recommend you something that you can get on your own, get exactly that. Yeah.
And there are times where we'll be like, hey, we don't necessarily have access to this. You can get it. There are a couple supplements out there that you can get at Costco or Sam's or other stores out there. And we're like, yeah, that one's fine. Go get that. Yeah. If you want to do that, that's fine. But if we're telling you specifically something, get this one, and you don't know where to get it, or we have access to it, whatever the case is, just get it through us.
And if you have questions on this, if you're seeing any of this and you have questions, reach out to us, DM one of us, get a hold of us, call us, and ask us more questions. Because if you want to supplement your athlete or yourself, like we do it for some general clientele too. There's a Vital Performance box that we have made that we do the same thing with general clientele, but at least ask, and we'd be happy to answer any questions. We've sent some people, we have like a college athlete, just like a wellness bundle. And it's like, well, they don't need a whole lot of anything here. So here's boom. And people just can order it. They're going to be able to order it online, but you can send them trusting, where it's coming from and what's in it.
Yeah. Cool. Well, that's all I got so far.
That's it. Cool. Yep. No, that was good. So as we head in through the fall, good luck to everybody this season, whatever it is you're playing. We're excited to keep up with a lot of our athletes. We've sent handfuls of them off to college and particular schools for particular sports. And so that's super cool, but excited for what's coming the rest of this year and some of the other things that we're going to be uncovering. But Good luck to everybody as you start your fall sports. If you need us, you know where to find us. We're happy to be here. Let's have a great end to the year. Fall's upon us. The pumpkin spice lattes have been released. I guess it's officially staring down fall. So have a great rest of your week. See ya.